that came up that Susanna is working on it.
It's okay. Okay. We are now live streamed as everybody can read all over their screens right now. Welcome to the Health and Government Operations Committee. Tonight is our 9th voting session. And we have with us a guest tonight, Delegate Pat Young, sorry, from Appropriations. We're going to start with, let's get the numbers right and in the right order, which is non-trivial. Which one would we like to do first, Lindsay? We don't have to be in numeric order. Let's do them in the most logical order.
In that case, I think we should start with House Bill 1346.
Okay, 1346 will be number 1.
And then I suggest House Bill 1202.
Will be 2.
Third House Bill 1205.
Thank you. Okay, so Delegate Young, let's let Lindsay sort of walk through the amendments and then we'll call on you.
Just so everyone's aware, there were amendments included in your packet in page 96, but a separate email went out to everyone that included the interlineated version of those amendments. I accidentally sent the amendment version rather than the reprint of the bill. So the reprint should have been sent separately. So if everyone wants to follow along with that version that came outside of the packet email.
Do you need a minute to get that up? If you do, we'll give that to you. Okay, looks like you're ready to go. Lindsay?
This bill codifies the Cybersecurity Coordinating Council and Office of Security Management in DO-IT. These were created by executive order. The State Chief Information Security Officer, which I will refer to as the CISO, is the head of the office. The bill establishes responsibilities of the office. They're responsible for coordination of overall cybersecurity strategy for units of state government, and support cybersecurity operation of local governments in coordination with the Maryland Department of Emergency Management. I'll refer to them in the future as MDEM. The council provides advice and recommendations to the CISO on cybersecurity strategy, prioritize risk and make recommendations for the budget, study partnerships and promote cybersecurity education. The bill creates the Cybersecurity Coordination Operations Unit in DO-IT. Amendments, which I'll get to, moved them from MDEM to assist political subdivisions. The IT policy for the executive branch is centralized under DO-IT, but state agencies can maintain their own IT units. DO-IT coordinates local cybersecurity procurements paid for by the state. And DO-IT must develop and maintain statewide cybersecurity master plan and consult with the Coordinating Council on Cybersecurity Strategy. There is a mandatory appropriation from the governor for implementing the statewide cybersecurity master plan and a report from the governor on IT budget information. And the bill establishes requirements for state and local cybersecurity preparedness assessments and reports and requirements and procedures to report cybersecurity incidents. The amendments that were adopted in the Government Operations Subcommittee, as I mentioned, move the Cybersecurity Coordination and Operations Office from MDEM to DO-IT, and it instead renames it as the Cybersecurity Coordination and Operations Unit, specifies qualifications for the CISO, specify that the Office of Security Management is not responsible for the information technology installation and maintenance operations normally conducted by units and locals, alters the membership of the Cybersecurity Coordinating Council, takes out language that would have exempted meetings of the council from the Open Meetings Act, exempts IT procurements from the State Board of Elections, Office of the Attorney General, the Treasurer, Comptroller, and Legislative and Judicial branches from DO-IT control, and specifies that state agencies may maintain their own IT units, and takes out language that would have centralized IT procurement for all units of state government under DO-IT.
Delegate Young, would you like to try to give an overview of how this, what this is trying to do?
Sure. And with the 2 other bills that we present, they will all tie together. The best way to think of 1346, and while as was brought up in the leadership meeting earlier too, this was the larger of the 3 bills. So the number came later because it was finished later. But this was the largest of the 3 bills. And the way to think of it is that this is the bill that was focused on centralization and what I've been terming as centralization light. because there was, as soon as we dropped the original version, and as I mentioned in my testimony, 10, 12 agencies contacted my office right away, begging to be taken out of it because it was misinterpreted in terms of the original language. We've addressed those concerns related to folks being able to keep their IT agencies. There was not an intent to physically take them or take away their expertise from their own departments. This is the bill that talks about governance related to state and executive agencies. 1346 moves us in a direction, sets up a framework towards centralization while not completely moving or taking Maryland's cybersecurity and IT services in every executive branch and putting it all under do it, because that would be, in my opinion, a bridge too far and not something, as we like to think, we're a pragmatic body. So this is sort of the direction that other organizations and states are moving, but we're moving towards adding responsibilities and as well as capabilities to do it, while also keeping autonomy for agencies that have an expertise in doing the work that they've continuously done. So that is a basic view in the way that we like to think of 1346. And then the other two bills also have their own focus that I'll address, but I'm happy to answer questions because that's the general view. Lindsay's done an amazing job of making the drafting the amendments and then going into detail, but I'm happy to answer questions to anybody in the committee.
I don't see any hands up. I take that to mean you have no questions about this bill. So we will move on to the second bill in the package.
Do you want
Which
to
is-
vote this bill or do you want to wait until all three bills have been discussed?
Oh, does anyone have a preference? I could move the bill. That's our normal process. That's a good point, Lindsay. I was thinking they were so tied, but why don't Delegate Young, no, you're not on the committee.
Move the amendments.
Thank you. Is there any discussion of the amendments? All those in favor say aye. All
Aye.
those opposed, please raise your hand so that I can see it. Virtual hand. There you go. Okay, I see no virtual hands or any other kinds except maybe Delegate Hills because it's here, but I'm not confused by that. So the amendments pass unanimously.
Move the bill as amended.
Second.
Is there any discussion? All those in favor say aye. All those opposed,
Aye.
no. Please raise your hand if you're a no. Looks like the bill passes unanimously. We will now move on to House Bill 1202. Lindsay.
So the reason we're doing these two bills together is a lot of the provisions in 1202 are duplicative of provisions in 1346. That's partially because of drafting convention, which has to consider that there's always a scenario in which one bill passes and the other doesn't. So if you need provisions in order to make your bill make sense, they have to be in the bill that you have in front of you. So this bill creates the Cyber Preparedness Unit in MDEM as a resource for local governments. Again, codifies the Office of Security Management and the State Chief Information Security Officer that were created by executive order and requires local governments other than municipalities to do cybersecurity preparedness plans, complete annual assessments, and report. There are amendments in your packet that begin on page 72. These are just a little bit different than what was adopted in the Government Operations Subcommittee. The reason for that is there was feedback from MDEM that was discussed in the subcommittee with concerns about what was originally in the bill, the Fusion Center, and was being renamed as the Information Sharing and Analysis Center in MDEM. They had concerns about that. So the amendments that are in your packet now strike the language in the bill relating to that Fusion Center. It's not being created in the bill anymore. The amendments also strike language creating a local cybersecurity support fund. That's moved into the next bill that we'll discuss, 1205. It clarifies procedures for local governments to report cybersecurity incidents, establishes qualifications for the CISO, establishes responsibilities for the Office of Security Management related to assistance for local governments.
Delegate Young.
So 1202, in terms of a overarching narrative, where 1346 is the state governance bill and centralization bill. 1202 can be and should be thought of as the local bill establishing a relationship that currently doesn't exist between local governments and the state, and also allowing for what I think we've noticed has been missing from these cyber attacks. There, especially in Baltimore County, Baltimore City, there isn't a formal role for the state to play in order to help getting back to normal. So in terms of an overarching view of 1202, we're establishing a relationship and a structure where the state is playing a role in helping local governments prevent cybersecurity events and hacks, assisting once a hack happens, and then also providing a role for them to assist in getting back to normal again after an event has occurred. And just the reference to where MDEM had brought up some concerns and we took out the language. There are things that they're already doing related to cybersecurity, but what the bill does is clarify the role that DO-IT has, as well as the role that they have. And some of it was, we thought it was important to clarify what happens within MDEM and who's responsible, and they felt that it was too prescriptive. So taking out all those measures does not change the intent of the bill, does not change that relationship that we're creating. And this, as you'll see in the very next bill, there's a funding piece that's tied to this relationship that we're creating between state government and local government. Happy to answer any questions related to that and also about specifics
Let's have somebody move the amendments.
Move the amendments.
Second.
Is there any discussion or questions regarding the amendments to this bill? Delegate Lewis.
Thank you, Madam Chair. Thank you, Delegate Young. My question is, how would things be different if a municipality was hacked next time? For example, in 2020, Baltimore City government was hacked. How would this bill make a difference?
Sure. And I think that what we're presenting to is that where our experts in terms of emergency response lies with MDEM, whether it's cyber, whether it's a hurricane, whether it's an earthquake, in terms of a emergency response, those are the folks that have responded, that will respond, and that will continue to respond. When it's come to cybersecurity, and we've dealt with this from Baltimore County with the public school hack, there are experts and resources available through DO-IT that could only be invited in to assist if need be. There was no role for them to play in the emergency management process. There was no role for them to play for suggestion or for assisting in analyzing what had happened and also helping them get back to normal. This provides a role for them to play related to when an event happens, but it also establishes a role for them to play in terms of when there's a request or when there's an interest in using expertise to find grants to the federal government, applying and offering trainings for staff, as well as just being a resource, not just for the state and for the executive branch, but being a resource for our local government so that we can be proactive. And even when those proactive measures fail, are there as a resource to then help get back to normal. So in terms of the Baltimore City hack, I would say that the role that doesn't exist now is that we're here to help. How can we help you? No, thank you, DO-IT. We don't need you. And they're like, well, now there's a role to play where like they can actually assist in that process and be involved in it. There's also the ability for assessments, which we'll get to in the other bill, that DO-IT will play a role in and can play a role in. This is all about being proactive, but knowing that the threat will always be there and that you can't guarantee 100% prevention. This expands the role and the relationship between DO-IT. So when we say, is the state secure? We're not just saying whether state government's secure. We're also saying that we're playing a role in making sure our local governments are secure as well. Does that answer your question, Delegate?
Delegate Lewis?
Yes, I think I'm frozen. I'm
You're
going to turn my
back.
camera off.
You're back.
Okay, yeah, I just turned my camera off because the signal's bad at the hotel. But thank you so much, Delegate Young. And if I could just a quick follow-up, Madam Chair.
Yep.
I'm curious to know how we will learn from the hacks that we've experienced, and if this entity would assist in a sort of statewide analysis, report, recommendations, so that we would continually improve our ability to protect ourselves at the local and state level.
Sure. And I think, and again, sorry for being a little disjointed. There in 1205, which we'll hear in a minute, talks about a funding mechanism as well as a carrot and a stick approach that MACO has approved and also has been on board with that requires assessment and encourages assessment to participate in the grant funds that the state would have available. But I don't want to get too far into that. In terms of this and codifying much of the executive order that's currently in place now and currently activating and working, the ability to assess and the ability to be brought in at a local level to assess, to see what the current capability is, to say what a local posture, a local government's posture in terms of cybersecurity is, technically could exist, but there is no codified or nothing in written law that creates it. I'm sure they would be welcome if somebody asked, but if it's not put into place, then there just isn't a formal role for them to play. So I would say that in terms of learning, it's been addressed, and there was concerns from the executive branch, which we've addressed through amendments, that there are certain reasons that a open meeting or a group could go into closed session, and cybersecurity discussions are one of them. So right now, where we've been frustrated, I think at the state and also at the local level of finding information related to a hack, this, I believe, creates a forum in which those conversations can happen, where we won't be shut down and we have to wait for months or possibly longer until there's an assessment of what actually happened. So I would like to think that by establishing in the passage of these pieces of legislation, it creates that forum and also has a reporting mechanism related to the legislature, so that we're able to have a better view of what happened and when an event or a cyber attack happens. Because currently there isn't a formal way for them to do that other than waiting for them to evaluate the hack. I don't know how long we're going to be waiting to find out what happened completely for the Department of Health, but we still don't know now. My understanding and my belief would be that this process and these committees, as well as these oversight groups that are put into place, will allow for that forum to take place and that conversation to happen. Sorry to be long-winded. I apologize if I'm going a little deeper into it than I meant to, Delegate. But.
It's very helpful. Thank you. Thank you. I'm keeping my camera off because the hotel signal is terrible.
Fair enough. Delegate Hill, do you still have a question?
I'll wait till after the three bills are presented.
Okay, that's a good thought. All right, we've moved and seconded the amendments. Is there any further discussion on these amendments? All those in favor say aye. All those opposed, please raise your hand in your virtual hand. I see no hands raised, so the amendments pass unanimously.
Move the bill.
Move the bill is amended.
Is there any discussion of the bill as amended? All those in favor say aye. All those opposed, no.
Aye.
Please raise a virtual hand. Seeing no virtual hands, the bill passes unanimously. With that, we will move on to House Bill 1205. Lindsay.
As amended, this bill establishes the local cybersecurity support fund to support local government cybersecurity preparedness, establishes the statewide reporting framework and oversight commission to ensure security of information and determine appropriate upgrades, establishes a framework for assessment of cybersecurity and information technology systems for each unit of state government, and makes DO-IT a primary procurement unit. There are amendments on page 56 of your packet that take out language from the bill that would have given the Stadium Authority bonding the Stadium Authority Bond Authority, takes out the Information Technology and Cybersecurity Infrastructure Fund, which would have been funded through those bonds, alters the membership of the Statewide Reporting Framework and Oversight Commission, and requires the commission to review and provide recommendations on DeWitt's network basic security standards, requires assessment reports to committees of the General Assembly, but prohibits those reports from containing information on the security of an information system, requires assessments every 3 years for state units rather than annually, establishes the local cybersecurity support fund, which I mentioned was from the prior bill, to support local government cybersecurity preparedness, and exempts procurements by DeWitt for the purpose of modernizing cybersecurity infrastructure valued at under $1 million from oversight by BPW, but requires an annual report on these procurements to BPW, excuse me.
Okay.
And
Delegate Young.
thank you, Madam Chair. For context and tying all of them together, the reason the fund existed in 1202, we moved it to 1205. One, in order to make it easier to explain all three of them in these three sections. 1205 can be thought of as the funding and procurement bill. When we had originally asked the drafters, we were taking a version of, I believe it was Massachusetts or Maine's framework, where they create bonding authority for the expensive infrastructure projects related to cybersecurity. Again, these were recommendations that came from the interim committee that met. But in terms of a Maryland response and what we are pragmatically working towards was a bridge too far in terms of giving bonding authority for $1.5 billion to the Stadium Authority. So that was taken out. The bonding authority piece was taken out, and we shifted to focusing on DeWitt's procurement responsibilities and capabilities, and putting the funding or the funding that would be provided through grants to DeWitt under 1205 to keep everything tight related to funding and procurement. So the carrot and the stick approach that we talked with Mako about, that lives here in 1205. If a local government would like to access these grant funds, they'll need to either do an assessment, a security assessment, which I believe, Delegate, I apologize. Delegate Hill, you didn't bring it up. When it was mentioned earlier about how does this relationship work? If a local government would like to access these funds, they have to do a cybersecurity assessment, either at cost conducted by DeWitt or through an approved vendor that DeWitt has identified that they can use, which then would allow them to access these funds and also expand this relationship that DeWitt would have with the local government. These projects can be related to infrastructure, can be related to education, or be related to anything that a local government would want or need or see in their ability to move their posture into a more secure stance. These funds would be available to them as long as they went through an assessment. So the idea being that we're enticing local governments to provide their own assessment or to get an assessment to the state, and then have access to funds that we are pulling from and offering from ARPA funds, as well as funds that have been identified and already allocated through the budget process. And also this idea of procurement, which I've brought up in a few conversations with individual members. These projects are expensive. And this idea that other states have granted, if they didn't have it already, a primary procurement authority to do it, so that they don't hit that speed bump every time that they're attempting to upgrade a system, move a system into a more modern position or stance. And that by increasing the cap to everything under $1 million, when it's specific to modernization and cybersecurity infrastructure projects, the oversight that some folks just want to make sure that this has been identified. Folks were concerned about assessment and oversight of those funds. Any other project, they still fall under the same requirements, the same restrictions as any other agency, unless it's modernization or cybersecurity infrastructure projects under $1 million. And with that, they also provide an annual report with those particular projects, depending on however many they may be. So it's not, they don't have a blank check, but they do have more leeway to move projects forward, as well as when it's related to increasing our cybersecurity posture. I will happy to answer other questions. Lindsay, I'm just throwing it back to you in case I'm forgetting something from 1205.
I think that's good.
That addressed those things. And now that we've mentioned them all together, the locals had been concerned, as well as the other agencies, about autonomy. Those were specific provisions in 1346 that we were taking out at the end, and we've added amendments that clarify that IT departments are still IT departments, while DO IT has an expanded role and an expanded ability to make sure that the state's cybersecurity systems are secure and our posture is moving in the right direction. They still have the ability and the autonomy to conduct day-to-day operations. So with that, I have to answer questions.
I'm going to call on Delegate Hill, and I'm then going to ask the Vice Chairman if she would take over running the meeting for a few minutes while I do something that needs to get done right now. Delegate Hill.
Thank you, Madam Chair. Thank you, Delegate Young. So a couple questions. So I understand the grant fund for locals. How are we paying for this at the state level? This seems like a much bigger project than DO IT's been doing. So do we have to have additional funds, or we're just taking it from our regular revenues?
So excellent question, Delegate. And I will mention that it was brought up during the leadership meeting, which from an appropriation standpoint, I will have a much more comprehensive total cost associated with these three bills. It's already been approved through the appropriations committee in the budget process, so the funds are already there. It's taking from funds that were allocated from the state budget, as well as funds that were allocated through federal funds through ARPA. So I will provide and have for Saturday, which I'm anticipating these bills come to the floor, a more comprehensive budget response to you. So that way, it's not the first time that someone's asked, and I want to make sure I have a clear response to you. The money is there, and it will be up to future administrations and legislatures to continue to fund based on one. We will have a better idea of how much these things cost from year to year because of the infrastructure in these systems and these organizations we're setting up now. Because the question is now, how much will it cost? And it's a question mark because we don't have folks assessing, and we don't have folks discussing or having the ability to get an answer back from some of our executive agencies.
Great. Okay. The next question is, there's an assumption here when DO IT is helping local governments that the state is doing it better than the locals are doing, right? I mean, there's a component where we want it going through the hacks. I think this committee has really asked questions over and over again about what our standards are, and are the locals following the same basic standards. But there's also this assumption from these three bills that DO IT does it better, and they need to be there to help the locals. So what happens when DO IT gets hacked?
What happens when DO IT gets hacked? Yeah. I would say that there's, and even before, there's no 100% guarantee of preventing these sorts of things. We can statistically, with just like other threats, better prepare so when they happen that we are able to get back to a new normal faster. I wouldn't say that DO IT getting hacked would necessarily affect a local or even a state agency that uses or is listening to DO IT. Because the relationship, and that's also why we've both discussed this idea of having a separate and autonomous IT departments and cybersecurity departments that now are required to, and also have to report certain aspects of what they've been doing to DO IT. But if DO IT gets hacked, it would be the same as if another agency get hacked. I mean, sure, it's a black eye. I mean, you are the agency that's supposed to be preventing these kinds of things. But also it's a reminder that no one is completely secure. But them getting hacked wouldn't prevent or stop a relationship. And I wouldn't necessarily say that the idea is that DO IT necessarily does it better. But right now, there's no mechanism in which to find out for sure, unless it's just voluntary, that we know how a local government's doing it. So by entering into a relationship through trying to access this grant, we have a better idea of where our locals are, the ones that choose to engage. And in the example of a local government that gets hacked that doesn't enter into this relationship, DO IT is there to assist. And in the example of a local government that has engaged in this relationship and gets hacked, DO IT is better prepared to assist and get them back to normal than if they weren't engaged in that relationship in the first place. I hope that answers your question. I'm trying to.
Yeah, I think what you're saying is it's about resiliency, it's about redundancy, but it doesn't create a domino effect where pulling the plug in one place like Do It is going to make all the other things fall down. Is that?
Yes, ma'am.
that's
Do
what
It.
you're saying?
Do It being hacked and potentially being offline does not prevent every other agency from doing what it does every day.
Okay,
all right.
thank you. And then the final question. We know what we experienced in Baltimore County, obviously the city and the state. You were trying to explain to Delegate Lewis earlier how things would be different. And what I heard is that there at least be a state agency that could have some awareness of what was going on behind the scenes. And maybe there's now a mechanism for them to share that information with not the full legislator, but some subgroup so that folks could know. But I didn't really understand if the claim is that by having these relationships that locals will be less vulnerable or that, I guess the question is, we know that what we heard before is we can't tell you what's going on because the FBI is involved. We can't tell you what's going on because the police are involved. We talked to the police and they said, we didn't tell them they can't talk to you. So this is going to allow the conversation, but is the FBI being involved or other things being involved going to step on Do It? So even though they have this relationship with the locals, they're still not going to be able, am I asking, understand what I'm saying?
I understand.
There's a relative relationship between all these different groups that are already investigating stuff. How does that play into either helping us to find out what we need to do and learning from it, or stopping us? Because I don't think the idea here is just that Do It's going to somehow prevent it, as you said, but we're hoping to learn from it and know where the failures are in advance.
To the scenario that you're bringing up, and I hope I'm addressing it appropriately. In the event, and it's my understanding and belief through the structures that we're putting in place and the expansion of a role for Do It, is that while, for instance, Baltimore County, where we had a meeting with the folks we thought should be able to answer our questions, but we could not have those questions answered because there was an investigation that, one, utilized in the bill through amendment, identifying certain security information that should not be provided publicly or should not be put out, that we should be able to receive, or at least one of the committees or oversight units would be able to receive that information in closed session, where we could receive answers, not necessarily directly from the agency, the department, or the government that's hacked.
Yeah.
But there would be that opportunity or forum to be, that is my belief and my understanding from the bill. And I preface it that way because we know that once the bill has been passed, that it's interpreted differently from the folks that we are attempting to not control, but in order to direct in a more positive way. So that is my understanding and my belief from the way that we've fashioned these bills and from the recommendations that came from the interim committee that would provide a forum in which to find more answers, even while an investigation would be going on, while at the same time not undermining current practice or getting in the way of active investigations or something that would break the law. Does that make sense?
That does, and that answers my question. Thank you very much.
You're welcome.
Madam Vice Chair.
Delegate Bagnall.
Oh, she's back. Okay.
Thank you, Madam Chair. And I'm going to try not to belabor this because I trust the work of our committees and our subcommittees, our commission. I'm just trying to wrap my head around this a little bit because obviously some recent events have shaken our confidence a bit. So I'm just trying to understand, does the expertise exist in Do It for this, or is the expertise in Do It for finding the right expertise? In other words, is it outsourcing? Is it internal? Is that part of the work of that bill, or is this just sort of the first steps in getting those standards, and then we expand from there?
It is my intent, and I believe it's the bill's overall intent, especially now with the amendments, that one, we are codifying the CISO as the executive's bill would do. And we are also, thanks to the chair, identifying minimum standards of that would allow of what this CISO and what this position should have, where right now they don't exist. Which is, to answer your question, the intent by passing this legislation would ensure that the expertise is within Do It, and not necessarily the question you asked, but part of it, where we have MDEM who has the expertise in emergency management, regardless of what the emergency is, the expertise related to cyber and related to cybersecurity, outside resources that could assist depending on what the threat is, what the hack is, or what the attack is also at the table to provide their expertise outside of just the management of an event, as MDEM does. So I would say that the intent of this legislation is to make sure that the experts are within Do It.
Thank you. Thank you, Madam Chair.
Thank you. I see no other hands. So I assume that the questions have been answered. I assume this, the amendments have been moved. Is that accurate?
Move the amendments.
Second.
Any further discussion? All those in favor, please say aye. All those opposed, please raise your virtual hand. I see no hands on the screen. The amendments pass unanimously.
Move the bill as amended.
Second.
Is there any discussion on the bill as amended? I see no hands. All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Okay,
Thank you, Madam.
Delegate Young, thank you so much for being here today. We appreciate it as the chair of the Joint Cyber Commission, Cyber and
Cybersecurity, IT, and biotech.
thank you
It's a
very much.
mouthful.
I knew you would know it.
Madam Chair, can these bills be
Oh,
sponsored?
you know what? That's a good point, Delegate Hill. There are 1 million amendments on all three of them, so there's no reason we can't add another one. Is there anyone in this group who does not want their name added to these bills? You will all be added as co-sponsors, including me. We will all be added as co-sponsors of these three bills.
I would like to be a co-sponsor unless we're hacked again, and then I want my name removed.
Say that again?
I said I'd like to be a co-sponsor unless we get hacked again, and then I'd like my name removed.
Thank you. We'll take it off then. I'll probably not be here. I'll probably be somewhere sunny when you're doing this next year.
Madam Chair, if I may, I'm here for any questions that result from this conversation beyond. Please just reach out to my office. I'm happy to discuss the bills with anyone.
Thank you. And thank you very much for getting us through this process so well. I appreciate you being an honorary member of our committee, at least temporarily.
My last year, I'm honored. Thank you.
Okay, bye-bye. Okay, with that, we're going to move to the agenda, basically in the order it's in. And I'm going to get back to page 1 somehow. There we go. We have 2 withdrawn bills. All those in favor of allowing House Bill 982 and 1160 to be withdrawn? Oh, I need a second.
Second.
Oh, please say aye. All those opposed, no. The ayes have it. We'll allow those sponsors to withdraw their bills. House Bill 28, Lisa and Delegate Kelly.
This bill expands the scope of practice for a licensed pharmacist who meets specified requirements to include prescribing and dispensing nicotine replacement therapy medications approved by the U.S. Food and Drug Administration for the purpose of aiding in tobacco cessation or smoking cessation. There are amendments on page 1 of your packets. They define the term nicotine replacement therapy medication and incorporate the term throughout the bill.
Thank you. Delegate Kelly, I believe it was, yes?
Absolutely. So with the amendments, which passed unanimously, the bill passed unanimously, the amendments eliminated MedChi's opposition to the bill. Move the amendments.
Second.
Is there any discussion of the amendments? Seeing no hands, all those in favor say aye. All
Aye.
those opposed, please raise your hand. The amendments pass unanimously.
Move the bill.
Second.
Any discussion of the bill as amended? All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously. Okay. We'll now move on to House Bill 109. Aaron and Delegate Penny Melnick.
As amended, House Bill 109 requires, subject to the approval of the Secretary of Health and the State Advisory Council on Hereditary and Congenital Disorders, the Maryland Department of Health to screen for each core condition listed in the U.S. Department of Health and Human Services recommended uniform screening panel. There are amendments in your packet on pages 3 through 6 that require the Secretary of MDH and the Advisory Council to determine whether to approve the inclusion of a condition in the system for newborn screening within 1 year after the addition of the condition to the newborn screening panel. The amendments set forth the requirements to be followed if the Secretary of Health or the Advisory Council do not approve the inclusion of the condition, provides that if the Secretary and Advisory Council approve the inclusion of the condition within 1 year of the approval, MDH shall implement the testing. And if the implementation of testing requires the procurement of specialized testing equipment, they are required to sign a final procurement contract with a vendor for all equipment necessary to implement testing.
Delegate Penny Melnick.
Thank you, Chairman. The vote was unanimous in committee. The Department of Health does support the bill. And I move the amendments.
Second.
Is there discussion of the amendments? All those in favor say aye. All those opposed, please raise your hand. Seeing no hands.
Move the bill.
Second.
Any discussion of the bill as amended? All those in favor say aye. All those opposed, no. Raise your hand. Bill passes unanimously.
Thank you.
House Bill 293. Aaron, Delegate Penny Melnick.
The bill establishes a 988 trust fund to provide reimbursement for costs associated with designating and maintaining 988 as the universal telephone number for a national suicide prevention and mental health crisis hotline, and developing and implementing a statewide initiative for the coordination and delivery of the continuum of behavioral health crisis response services. There is an amendment on page 7 of your packet that lowers the budget appropriation in fiscal 2024 from $10 million to $5.5 million.
Delegate Penny Melnick.
Thank you, Chairman Pendergrass. This actually is a mandate from the federal government. The federal government actually passed this bill, and it is requiring the states to establish and fund the 988. Congress designated 988 as the phone number for the National Suicide Prevention Lifeline. Starting July 2022, all telecommunications company will route 988 calls to local crisis centers that are part of the Lifeline network. In Maryland, we also have 211. 211 will still be active, but they're going to be, it is expected that calls and text to 911 will increase and that the locals will be overwhelmed, so they'll be able to send those calls to 988. The federal government did allocate $282 million through SAMHSA, but they're requiring states to also put up some money. This, they will work with the states to get the word out so people can become familiar with 988 and start using that. 988, it's going to be sort of like the 911, where it's going to be the mental health crisis hotline for people that have addiction problem or contemplating suicide to be able to call. That's it.
Move the amendment.
Is there a second? Is there discussion on the amendment? All those in favor say aye. All those
Aye.
opposed, no, or raise your hand. Seeing no hands, the amendment passes unanimously.
Move the
this
bill as
very important
amended.
Bill.
Is there a second? Any discussion on the bill as amended? All those in favor say aye. All those opposed, please raise your hand.
I believe
Delegate
Delegate
Shalega, I see a hand. Did you want to discuss it or were you voting no?
Yeah, I wanted to ask a question.
Well,
So
go ahead.
I'm on the subcommittee, but I saw on the TV a number at the end of a program for suicide. I've seen it twice. That's a long number. So what are they going to stop using that number and start?
Yes, they will.
Number?
Yeah, they will.
then
So that's the lifeline number. And this 988 will replace that. It's to make it a lot easier for people.
Okay, I guess my next question is, if the federal government is making us do this, why aren't they paying for it?
They did allocate $282 million, but it's not enough. And they're asking the states to contribute funding. There's actually for example, the governor in Wyoming requested $7 million from his state to implement it. Many other states are implementing telecommunications surcharges to come out with the funding. And we don't want to do this in Maryland. So that's why we're doing what we're doing.
And is it going to be a legacy cost forever and ever? I mean, are we going to pay $5 million a year?
What we heard,
or-
what we heard in the committee was that they're going to reassess and discuss and see if that's enough for the funding. The governor's office, I think, the state, they met and they discussed, they said that we needed about $7 million. So we're going to get, I believe, $2 million from the federal government. Am I right, Erin?
1.8.
Yeah, that's-
1.8
yeah, we
from the
talked
federal
about it
government.
in Subcommittee, but okay. I have concerns about the way this is being implemented, but I'm still going to vote for it.
Well, thank you for your questions, so I appreciate it.
Okay, all those in favor, please say aye. All those opposed, please raise your hand. Seeing no hands, the bill passes unanimously.
Co-sponsor amendment, please.
I don't know how popular this is, so I can reverse the question. Is there anyone who does not want to sponsor this bill? Please raise your hand if you do not want to sponsor. I see one hand. Everyone else is comfortable being a co-sponsor. I see two hands. Okay, everybody except Delegates Shalega and Delegate Riley will be co-sponsoring this bill. Okay. Thank you all. House Bill 325, Lindsay and Delegate Rosenberg.
This bill, as originally introduced, shortened the timeframe within which state agencies must make payments under procurement contracts from 30 to 15 days after the day on which the payment becomes due or the day on which the agency receives an invoice. It also made conforming changes to other provisions, including those regarding the accrual of interest on unpaid balances. As originally introduced, the interest on unpaid invoices began accruing 15 days after a unit receives an invoice rather than 45 days. And the bill also would have required counties and municipalities to adopt payment policies consistent with the state's requirements. The amendments on page 8, that begin on page 8 in your packet, were adopted in Government Operations Subcommittee. Remove language from the bill that would have applied to local government payment practices, shortens only the timeframe for interest to begin accruing on unpaid invoices, but to a lesser degree to 37 days from 45 days, and tasks DLS with studying payment processing timeframes and the fiscal impact of further shortening those timeframes.
Delegate Rosenberg.
As council just said, the time for the interest payment is reduced significantly, the change for a week's difference, and a study by our DLS staff due December 1 of this year on the issues raised by the bill is introduced, unanimous in committee.
Would you like to move the
So
amendment?
move the
Second.
amendments, sorry.
Second.
Any discussion on the amendments? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands.
Move the bill.
Well, if the amendments pass, who wants to second the
Second.
bill? All those in favor, discussion? All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously.
Sponsor. Co-sponsor.
Who would like to be a sponsor of this bill? I'm asking it that way first. I'll ask it the other way in a minute if I need to. I see, would you put your virtual hand up if you want to sponsor the bill? Your virtual hand. I can count those more easily, believe it or not. Kind of. Okay, we're gonna ask for all those who, have I got 2 rows? I'm confused here. 1, 2, 3, 4, 5, 6, 7, 8. I hate this. I miss you guys being in the same room with me. 4,
It's 10.
And 11.
11. Okay, let's just count the hands that are on there to co-sponsor. We have Delegate Pena-Melnick, Delegate Kipke, Delegate Landis, Delegate Robin Lewis, Delegate Saab, Delegate Hill, Delegate Johnson, Delegate Lewis Young, Delegate Chisholm, Delegate Benderi, Delegate Kerr, Delegate Pendergrass. I think we're done. Did I miss anyone? Aaron or Lindsay, did you get all the names that I read?
Yes, I have them.
Delegate Landis.
Yes.
I have Landis.
Okay. Did the other staff also take account just to make sure that you got them all? Did you guys take your hands down when I called your names? Is that why everything kept moving and confusing me?
Yes.
And if so, did you do that on purpose just to see if you could fluster me?
No.
I didn't touch it. It just
They
disappeared.
time
It
out.
went away by
Gentlemen.
itself.
Oh,
Yeah, they
okay.
time out.
So
They
that may
timed out?
have
I
been
thought the
me.
hands didn't time out.
No, that was me. I was just putting them down as you were calling them. So
Oh, so-
my apologies.
And did you write them down, Richard, or did you just assume that we'd all remember and get it right?
No, but this is recorded.
Okay, good. I forgot about that. Excellent.
Yes, ma'am.
Okay. I need to move now to House Bill 7.
No,
No,
581.
581. And that is Lindsay and Delegate Rosenberg, a real team here.
There we go. Thank you.
This bill prohibits, with certain exceptions, the disclosure of the contents of any written or oral communication regarding a peer support counseling session by a peer support specialist or a peer support participant for fire, rescue, and emergency medical services entities. By October 1st, 2024, the Behavioral Health Administration must develop a report on best practices and professional standards for a peer support counseling program as specified. BHA must make the published report and a list of peer support specialist training programs publicly available on its website. The amendments on page 11 in your packet were adopted in Government Operations Subcommittee, require BHA to consult with the Maryland Institute for Emergency Medical Services Systems in developing a report on best practices and professional standards for peer support counseling programs, and these match the bill to the Senate cross file.
As a result of these changes, in addition to conforming to the Senate cross file, it was unanimously adopted by the subcommittee in terms of these best practices, and I would move the amendments.
Second.
Is there any discussion of the amendments? I see no hands. All those in favor of the amendments, please say aye. All those opposed, please raise a hand. The amendments passed unanimously.
Move the bill as amended.
Excellent. Is there a second?
Second.
All those in favor of the bill, please say aye, and if you're opposed, please raise your hand. I see no hands. The bill passes unanimously. Okay. House Bill 746 is next on our list, and I am going to hold this to get an answer to a question, and I expect we will see it back on the voting list tomorrow. With that, we're going to move to House Bill 767, Lindsay and Delegate Rosenberg.
This is an emergency bill that limits the contract term for an emergency procurement, and as originally introduced, prevents an emergency contract from being renewed. after it expires. If there are any unmet needs after the 6-month term, a procurement officer must use procurement method other than emergency procurement to award a new contract. The amendments that begin on page 28 in your packet, adopted in Government Operations Subcommittee, extend from 6 months to 12 months the time limit on the contract term for emergency contracts, allows a unit to renew an emergency contract with approval from BPW, and allows a unit to use expedited procurement in addition to other procurement methods other than emergency procurement to extend an unmet need from the emergency procurement.
Delegate Rosenberg.
Yes, I offer these amendments after discussing the bill with the players in procurement. DPW is now mandated to be involved for there to be a continuation of an emergency contract past the 12-month period. So this was unanimous in the subcommittee. I would move the amendments.
Is there a second? Is there discussion of the amendments? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands. Delegate Rosenberg,
Move the bill as amended.
Second.
any discussion of the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. Bill passes unanimously.
Sponsor amendment, Madam Chair.
There are amendments, so we can do that. Okay. Is there anyone who does not want to be a sponsor of this bill? You don't want to be. I see 2 hands. Are there any more than that? I would expect there might be more if I see those particular 2. Okay, I see Delegate Chisholm, Delegate Kipke, Delegate Riley, Delegate Shalega, Delegate Kaiser, Delegate Morgan, Delegate Saab. I see no more people who would like to not sponsor the bill. Okay, I assume staff has that. Tell me if you don't. With that, we will move to House Bill 900. This is Aaron and Delegate Pena-Melnick.
House Bill 900 prohibits the Maryland Department of Health, any local health department, from collecting a fee for a certified or abridged copy of a death certificate of a first responder killed in the line of duty if the copy is issued to a surviving spouse or child and will be used in connection with a claim for a dependent or beneficiary of the first responder. There are no amendments.
Move the bill.
Is there a second? Is there any
Thank you.
discussion? All those in favor say aye. All those opposed, no. Please raise your hands. The bill,
Sponsor amendment.
We're not allowing sponsors on
Oh,
bills
no
that don't
amendment.
have amendments.
thank you,
Delegate.
Delegate Kipke, for being right there on the ball. That bill passes unanimously, but there will be no co-sponsors on that bill, even though our hearts are in it. Our names are not. Okay, House Bill 968, Lindsay and Delegate Kelly.
As originally introduced, the bill establishes a certified dental assistant credential and specifies the additional intraoral procedures that may be performed by a CDA. The State Board of Dental Examiners may adopt regulations, including reasonable policies and guidelines for a dental assistant to assist in performing authorized intraoral procedures and reasonable education or training requirements for an individual to become a CDA and perform the authorized intraoral procedures. The amendments that begin on page 31 in your packet were adopted by the Health Occupation Subcommittee. They changed the terminology from certified dental assistant to expanded function dental assistant. Authorizes a dental assistant to assist in performing intraoral photography under the general supervision rather than direct supervision of a licensed dentist without being certified by the board. Change the minimum age from 17 years to 18 years for an applicant. Clarifies the monitoring of nitrous oxide that an expanded function dental assistant is authorized to perform when certified, and specifies the course of study that the board may approve for applicants for a certificate.
Delegate Pena-Melnick.
Kelly.
Kelly. Oops.
That's okay. Delegate Kipke did a great job working this all out with the amendments. Everybody who came to the hearing, you may remember Bruce Bariano had a client who was concerned. He was able to work that out with the dentists. The hygienists have been, got there. Oh, they were okay. They don't love it, but they're okay. So with that, I move the amendments.
Second.
Any discussion? All those in favor, please say aye. All those opposed, no. Please raise your hand. The amendments pass unanimously.
Bill is amended.
Is there a second? Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 96.
Sponsor amendment,
What?
co-sponsor amendment, please.
I think I heard co-sponsor amendment.
Correct.
Okay. How many people would like to co-sponsor this bill? Raise your hand in your virtual hand. Let's go with the virtual hand.
And
I may have to reverse the question. We'll see. Oh, it looks like I could do it either way. So why don't I do this? Delegate Bagnall, Delegate Kerr, Delegate Johnson, Delegate Lewis Young, Delegate Hill, Delegate Robin Lewis, Delegate Peña-Melnick, Delegate Kaiser, Delegate Kelly, Delegate Landis, Delegate Banderi, Delegate Pendergrass. Okay,
And Chisholm's up too.
Delegate Chisholm.
Delegate Chisholm, I'm sorry, I missed your hand.
And Delegate, Saab, did I see your hand before?
Who?
I thought I saw Delegate Saab's hand before, but it's not up now.
You did. I changed my mind.
Okay,
okay.
good. Thank you for letting us know. And Lindsay, thank you for being careful not to omit someone. Okay, that bill is also co-sponsored. House Bill 969, Lindsay and Delegate Kelly, another great team.
This bill, as originally introduced, altered the nomination process for the State Board of Dental Examiners. It requires board members to be trained for at least 1 hour each year on the board's powers, duties, and procedures, including complaint and hearing procedures. After consultation with the State Bar Association, the board must select an attorney with the appropriate expertise to provide the required training and require each member of the board to attend the training and receive documentation of completion from the attorney completing the training. The board must include a summary of the training and attendance in the board's annual report. The board must issue a final decision on an action within 120 days after the final day of a hearing. If the board does not issue a decision within that time, the individual who's the subject of the action may provide a written notice to the board that the individual has not received a final decision. Within 30 days of receiving that written notice, if the board does not issue a final decision, then the decision must be in favor of the individual who's the subject of the action. The bill establishes and codifies board processes related to the issuance of summary suspensions. If the board determines there is a substantial likelihood that a licensee poses a risk of harm to the public health, safety, or welfare, the board must issue a final decision on a summary suspension within 60 days after the final day of an evidentiary hearing. The amendments that begin on page 40 of your packet remove the provisions of the bill that altered the nomination process for the State Board of Dental Examiners.
Delegate Kelly.
Thank you. With these amendments, we conformed the bill to how it passed the Senate unanimously and it passed the subcommittee unanimously with the amendments. Move the amendments.
Second.
Is there any discussion? All those in favor of the amendments, please say aye. All those opposed, Delegate Hill, you're waving your hand. I'm recognizing you.
Right, I thought it was up. Thank you. Delegate Kelly, so this thing about if it's not approved within 30 days, it's automatically deemed as approved. Is that consistent with any other professional boards that?
So I can barely hear you, but I do understand your question. It is an outlier for sure. This is something, we have seen challenges with the dental board. We've looked at them for years and years and years. So while this is an outlier, it's something that we felt is appropriate and the Senate also determined is appropriate. There have been some real challenges in Anne Arundel County in particular, but statewide for a long time. And we need to do something to get things moving with the dental board. So we're trying this.
Okay, and when's the sunset on the, when do they come back again? Because I'm very concerned about, they raised interesting questions about sometimes the delay in giving it is due to the fact that there's a reason that they may end up making a decision not to give the license. So never mind.
I'm not, Lindsay can probably answer when their sunset is, but I can answer that they gave a lot of reasons why there were delays, and we have heard many reasons for a long time why there are delays. I think the main problem is that they are significantly understaffed and continue to be significantly understaffed. They have 10 open pins, 5 of which have been approved that they are not filling for some reason. So this is one of the challenges. But Lindsay, can you answer the sunset question?
بالعكس.
Sorry, I'm looking it up and while navigated away from the screen, could not take myself off of mute. Just a minute. It looks like they terminate July 1st, 2031 is the next.
Okay, that seems like a
Evaluation
long
for-
time with the.
That doesn't prevent us, Delegate Hill, from reassessing this if this proves to be a problem. What we know is a problem is the current situation. We know for a fact it's a problem. This is not something that came up this year. This is something I would say for at least 10 years we have been looking at, thoughtfully considering. Last year we passed legislation that the Senate did not move. So strategically, we just think passing something that conforms to how the Senate passed it unanimously is the smartest way to make some improvement in an area and a board in particular where we have significant concerns. We want to protect the public safety, and we think this is a good step to take.
Well, I would not push it, but given the fact that it's 8-9 years, would you entertain at all, or would be a problem with the Senate amendment to put a sunshine on to look back?
I have been advised that the best thing to do is to conform this to the Senate exactly because of what we went through last year.
All right, thank you.
I will note that the Program Evaluation Act also allows for an evaluation sooner on request from the General Assembly. So the 2031 is just if nothing is done sooner than that, but that doesn't mean that an evaluation can't be done sooner than that timeframe if it's necessary.
And that would require legislation, right?
It requires I'd have to look at the exact procedures, but it requests to the Office of Program Evaluation.
Oh, okay. All right,
Yeah,
that's simple.
We can do that, and we have done that. I'm
And
sorry.
Delegate Hill, put a flag in your calendar to remind you to ask in a year or two to have that done. That's not an unreasonable thing to do. And I trust that if you decide you're going to remember, you will.
I will if I'm reelected. Thank you, Madam Chair.
And I can assure you, Delegate Hill, the dental board is something this committee, for better or worse, was going to be working with closely over the next few years on a lot of different issues. So we will be keeping a close eye.
Madam Chairman,
Yes.
we all know Sandy Rosenberg is going to get reelected. So let's assign this to him. Thank you.
I appreciate the endorsement.
Okay, so forgive me, I lost track in all that discussion. I think we have not voted the bill as amended. Is that accurate? We were about to and we stopped? Okay, all those in favor, please say aye. All those opposed, no, please raise your hand. The bill passes unanimously. House Bill 971, Aaron and Delegate Pena-Melnick. Kipke, you've been a busy delegate this year.
House Bill 971 requires the Maryland Department of Health and Behavioral Health Administration to ensure that the specialty mental health system has an adequate network of providers available to provide alcohol and drug abuse treatment to children younger than age 18. There are no amendments.
The
Delegate-
bill passed unanimous, so I moved the bill.
Second.
Second.
Any questions or discussion on the bill is before us? All those in favor say aye, all those opposed no. The ayes have it, the bill passes unanimously. That's where we are. House Bill 973, Lisa.
This bill specifies that each contract form or an amendment to a contract form between a pharmacy benefits manager and a pharmacy services administrative organization acting on behalf of a pharmacy may not become effective until the PBM, rather than the PSAO, files a specified informational filing with the insurance commissioner and makes other technical changes. There are amendments on page 47. The amendments require a PSAO to provide to an independent pharmacist an electronic or paper copy of specified contracts, amendments, payment schedules, or reimbursement rates.
Delegate Cullison.
Thank you, Madam Chair. So this bill was requested by the Maryland Insurance Administration in order to clarify some of their regulations with respect to the Pharmacy Services Administration organizations and clarify their paperwork, and everyone supported it, and it was unanimous out of the subcommittee.
You want to move the bill?
I would like to move the amendments.
The amendments. Thank you.
Second.
Is there discussion of the amendments? All those in favor say aye. All those opposed, no. Raise your hand. The amendments pass unanimously.
Move the bill as amended.
Second.
Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 1073, Lisa and Delegate Kelly.
This bill alters the components of the Advanced Directive Information Sheet prepared by the Maryland Department of Health and requires the sheet to be provided by additional entities. The bill also requires the Maryland Healthcare Commission to coordinate the accessibility of electronic advanced care planning documents in the state. It repeals the requirement that an electronic advanced directive service be established in a certain manner to connect to the state designated health information exchange. It requires Medicaid managed care organizations and health insurance carriers to take specified action, and requires the Motor Vehicle Administration to submit a specified report. The amendments are on page 48 of your packets. The amendments repeal requirements that electronic advanced directives meet specified authentication guidelines. They define electronic platform and add clarifying language that the platform will enable individuals to upload or save advanced planning documents. They exempt community providers, home health agencies, assisted living facilities, and hospice facilities from specified provisions of the bill. They specify that certain entities are required to provide a link on their websites to a tab on the state designated health information exchange website. And they provide that specified provisions in the bill do not require a managed care organization to assist in drafting electronic advanced planning documents or store the documents or access them. The amendments clarify the security standards that options to make electronic advanced planning documents accessible must meet. Specifies that the commission should explore linking the websites of carriers, managed care organizations, and healthcare providers to an electronic platform to which documents can be uploaded or saved. Specifies the entities the commission is required to consult in developing the electronic platform, and authorizes the commission to contract with a third-party vendor, and specifies that the electronic platform must provide non-visual access. Finally, the amendments clarify the circumstances under which a carrier is required to provide specified materials, and provide the specified provisions in the bill do not require carriers to assist in drafting electronic advanced planning documents, store the documents, or access the documents.
Delegate Kelly.
Madam Chairman, there's a lot of amendments on this bill, but Delegate Cullison did a wonderful job of getting a whole bunch of stakeholders on board with what is a wonderful bill in the end. So everybody was on board with this, and it did pass unanimously with the amendments. Move the amendments.
Second. Is there any discussion of the amendments? All those in favor say aye. All those opposed, no. The ayes have it. The amendments pass.
Move the bill as amended.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The bill passes unanimously. Do we want to do a sponsor amendment?
Delegate Cullison has her hand up. She might want to add something. Did you?
Delegate Cullison, did you?
Right,
want to-
I just, for the purposes of folks who might be watching, I just wanted to clarify that this bill, what it does is enables folks to upload advanced care planning documents so that providers, healthcare providers, can access them so that their wishes are actually known if they can't express them themselves. And it's a lot of words because it's a lot about how do you build the technology that does that in a very secure way. So in working on this bill, I just want to do a little PSA that says it's really important for folks to think about what they want in to happen and what kinds of care they want in the event of a health emergency, and let those wishes be known through this advanced care directive. So that's my PSA for the evening. Thank you, Madam Chair.
Thank you, Delegate Cullison. Delegate Saab, your hand is up. Is there a reason?
Yeah, actually, I wanted Delegate Cullison's great bill. I was getting excited about co-sponsoring.
Okay. Is there anyone who does not want to co-sponsor this bill? Raise your hand if you do not want to co-sponsor this bill. Okay, everyone will be listed as a co-sponsor of this bill. Good job, Houdini. House Bill 1082, Aaron and Delegate Penny-Melnick.
House Bill 1082 requires state and local agencies to use plain language in public communications about health, safety, and social services benefits. The University of Maryland Herschel S. Horowitz Center for Health Literacy is designated as the state's consumer health information hub to promote and ensure public access to specified information in preferred languages to inform decisions about health, safety, and social services benefits. For fiscal 2024 through 2026, the governor must include in the annual budget bill an appropriation of $350,000 to the hub. When awarding, there are amendments in your packet on pages 15 to 17. The amendments add a definition of plain language, provide that alleged compliance or non-compliance with the bill is not subject to judicial review, and strikes specific procurement language.
Delegate Penny-Melnick.
Thank you, Chairman. So we discussed this bill and voted. It was actually bipartisan, not unanimous, but it was bipartisan. This bill actually received a lot of support from the Maryland Health Benefit Exchange, the Hospital Association, CRISP, major insurance carriers, health facilities, MECHI. I work with them, and they all agree that it is an important bill. Many of them have used the Center for Health Literacy. I think that when we look at the total cost of care model in Maryland, one of our goals is to progressively transform care delivery across the healthcare system with the objective of improving health and quality outcomes. And we have not done that very well. This bill would allow state and local government agencies, health systems, nonprofit and community-based organizations to leverage the health literacy expertise, and the center will be a resource. It will promote the use of health literacy criteria, certification, best practices, and will identify health literacy barriers and help address them, especially when we think about disparities. You know, how do you navigate the system? How do you understand your prescription? How do you talk to your doctor? How do you become your own advocate so that you have the best outcome? So I move the amendments.
Second.
Is there discussion of the amendments? All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous.
I move the bill as amended. Oh, go ahead.
Is there
Sorry, I
any
just got
discussion?
excited.
The bill is amended. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes. Oh, I see two hands, three hands. Let's just give you a chance to get your hands up. Okay. I see Delegate Riley, Delegate Chisholm, Delegate Shalega, Delegate Morgan, Delegate Kipke, and Delegate Saab voting no. Do you have that, staff?
Yes, ma'am.
Okay, good. Thank you. Did I miss anyone? Okay. With that, we're going to move to House Bill 1082. Oh, sorry, that is 1082, 1127. And that is Aaron and Delegate Penny-Melnick.
This bill requires the state designated exchange to operate as a health data utility for the state and provide data as allowed by law to individuals and organizations involved in the treatment and care coordination of patients and to support public health goals. Dispensers are required to provide data to the state designated exchange, and after dispensing a prescription drug, a dispenser must submit prescription information to the state designated exchange. The state designated exchange may not impose any fees or other assessments on dispensers to support the operation of the exchange, and the Maryland Healthcare Commission must adopt specified regulations. There are amendments to this bill on pages 18 to 20 of your packet. The amendments provide that the bill applies to non-controlled prescription drugs, requires the regulations required by the bill to take into account consumer perspective, requires the state designated exchange to establish a consumer advisory council to bring the perspectives of individuals with an interest in protecting consumers into the delivery of services provided by the state designated exchange.
Delegate Penny Melnick.
Thank you. So CRISP is the state designated HIE. In Maryland, we have 12 HIEs that are not regulated like CRISP. CRISP is regulated, and it's actually have a lot more protections than the other ones. Some providers use the other 11. Many use CRISP. The hospitals in Maryland, all 46 of them use CRISP. There are actually about 2,000 primary care providers that use CRISP. A lot of the labs use CRISP. Medicaid and Medicare claims and hospital claims use CRISP. And this is an opportunity to basically allow them to become and operate as a health data utility for the state in the interest of public health. It has a lot of safeguards. They have been around for 15 years. When there was a hack in the health department system back in early November, CRISP was not one of the agencies. There was hack because their system is pretty tight, very secure as well. Interestingly, that I would like to point to the committee that during the pandemic, the Department of Health, the Secretary of Health actually used CRISP and mandated that the nursing homes give their data to CRISP as well. When there was a hack in November and we didn't have the information because the Department of Health didn't have those numbers, CRISP was the one that continued to provide those numbers to the, to the state of Maryland, to the population. So they contribute a lot to Maryland, and this is actually a great idea. And I actually moved the amendments.
Is there a second? Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands, so it's unanimous.
Move the bill as amended.
Second.
Any discussion of the bill as amended? I see some questions. I think we'll start with Delegate Riley and move to Delegate Saab.
Sorry, Madam Chair, I thought you were on the vote already.
Oh, no, not yet.
Okay.
I mean, I
Right.
thought I was getting there, but I saw your hands.
Okay.
Delegate
Thanks.
Saab, you too, you thought it was the vote?
Yes.
Okay,
Yes.
I'm sorry.
Sorry.
All those in favor say aye. All those opposed, no. Please raise your hands and I won't be confused this time, I promise. Okay. Those who are voting no are Delegate Shalega, Delegate Saab, Delegate Chisholm, Delegate Kipke, Delegate Riley, Delegate Morgan. Did I miss anyone? Have you got that, staff?
Yes, ma'am.
Okay, that's.
I would like, may I add something, Madam Chair? May I add something, Chairman?
Sure.
For Delegate Shalega, if you go to the website now and you try to opt out, you will see in the middle of the page where it says patients, there's a big blue button now that says opt out. They did that today in response to your question. So thank you so much for bringing that up.
Thank you. That was good. I actually opted out and I opted my husband out, but I had to hunt and peck to find the button. So good to know.
You don't have to hunt anymore. It's right there, smack in the middle.
All right.
Thank you for your suggestion. They took care of it this morning.
Awesome, thanks.
My
Madam
pleasure.
Chair. Madam
Yes.
Chair.
Delegate
I know-
Hill, I believe that was it?
Yes, I know I'm a bill late, but if it's not too late, I'd like to be a co-sponsor on the Hub Bill 1082.
1082, can we do that, Richard?
Yeah, they were amendments.
Yeah, but Richard, can you do it at this point without being too confused? 1082, add Delegate Hill as a co-sponsor?
That would be a question for the council.
Oh, okay, Lindsay? Or
Aaron.
I don't know who, Aaron?
Yeah, I'm fine adding co-sponsors along with Delegate Hill.
Thank you.
Okay, is there anybody else? Delegate Cullison has a hand up.
I would like to be a co-sponsor on that bill, on the Hub bill.
Okay, anybody else? Are we gonna get into a whole big thing here? Is this hands up for the Hub bill?
Yes, ma'am.
Okay, Aaron, I'm gonna
Hello.
read them off to you. If there are any other people.
hey.
who- What?
Sorry, Ann Kaiser is distracting me.
Okay. Blame it on someone else, whoever that is, right? I see Delegate Bagnall, Delegate Robin Lewis, Delegate Lewis Young, Delegate Hill. Anyone else? Excellent. Okay, you got that, Aaron? And thank you.
Cullison, correct.
Thank you, Erin, for your patience. I appreciate it. I know everybody wants to go home, especially staff who have put in a really, really long day today.
Really long day.
And a long day yesterday. And tomorrow I'm going to try really hard to get us done in the interval between session and session. And so you don't have to stay up late working tomorrow night. I hope. We'll see. House Bill 1219, Lisa and Delegate Cullison.
There are amendments on page 94 of your packets, and with these amendments, they strike all of the provisions in the bill except those related to destruction of records, and require the Maryland Insurance Commissioner to establish a work group to study options and requirements necessary for reimbursement of pharmacists who provide medical services within their scope of practice and in their work settings, and report back to Finance and HGO by December 31st, 2022.
Delegate Cullison.
Thank you, Madam Chair. When the bill came in, what the pharmacists were hoping to do was be compensated for the medical services that they are providing under their scope of practice now. Where we ran into some concerns was that in order for carriers, insurance carriers, to pay under the medical benefit, the providers have to be credentialed and as part of the insurer panel. And that's what would allow them to practice these particular activities in a setting outside of a pharmacy. This became much more complicated than we realized it would be. So what the amended bill does is acknowledges the pharmacist as a healthcare provider and creates a work group that will be convened by the Maryland Insurance Administration to determine how we can accomplish the goal of this bill. So I move the amendments.
Second.
Is there discussion on the amendments? Well, I have a question. I heard you say outside the pharmacy. Do you mean physically outside, like they're in a place that's not the pharmacy?
Physically, yes. What I learned in talking with people about this bill is that there are pharmacists who work in nursing homes. You know, that is their place of employment, or a federally qualified health center is a place of employment. And under our current rules, because they're not credentialed, they can't receive any payments, any reimbursements under the medical benefit.
Thank you. Delegate Hill.
Thank you, Madam Chair. Delegate Cullison, when they're working at these non-commercial pharmacy places, are they working as pharmacists, or are they working there in doing the injections instead of the nurses? I mean, aren't they working in the pharmacy on those sites or handing out medications and acting as pharmacists as opposed to?
They are working as pharmacists, but we've recently, over the last couple of years, given them the opportunity to do activities which fall under the medical benefit. And that's what they're looking for to be compensated for. And this is happening in a number of other states. It's a certain set of, I don't know what the CPT stands for, but it's the codes that are used to designate a particular service that grants their reimbursement. So that's what they're doing. And it's all within our scope, the allowable scope of practice within our statute.
So so I'm clear, so these are the things that they asked to be allowed to do a few years ago, knowing they wouldn't be reimbursed. And now they're saying, since we're doing them, we should be reimbursed. And yeah, okay.
They are reimbursed when they work inside a pharmacy. They are reimbursed for those things because it's the pharmacy that's credentialed. But those other settings are where they can't be reimbursed right now.
And I guess maybe it was my first question I wasn't clear about. So if they're at a federally qualified healthcare facility or they're at a nursing home, there are other healthcare providers there. What I'm confused about, and I'm sorry because I'm not on the subcommittee, is what procedures are they performing that there aren't other people? In other words, in the pharmacy, like we gave them injection authority and all that other authority, it was because there was no one else around there who otherwise had that. And we wanted to make sure, particularly in rural communities, that there was someone there who could provide these services. In these federally qualified healthcare centers, are they now not having nurses or other people? I'm confused about why they're performing these services when they're there as a pharmacist primarily.
Right. I hear your question, Delegate Hill. I think the answer is simply, it is a shared responsibility among all the staff since they are, staff within that building. Yes. And since they can provide the service under our statute, they, are doing it as part of their work. It's not like, and it may be shared among other staff, but they are also doing it.
Okay. Hang on a minute. Delegate Benderi, would you please mute your phone? Okay. Benderi, mute, please. Benderi, mute, please. Thank you. Okay.
And the study will be looking at that too, or it's just looking at the CPT codes?
No, it will be looking at all aspects of this kind of activity.
Okay.
It's the first time we've encountered this. So we have to look at all angles. And the commissioner has agreed to do it. And she's, the bill specifies, that she's going to work with representatives, or her team's going to work with representatives. And she said to me, we may have to pull in other representatives as well, from the Department of Health, maybe from the Board of Nursing, those kinds of discussions are going to have to happen.
Okay. Delegate Benderi, do you have a question?
I don't, Madam Chair. The CPT stand for current procedural terminology. That's all.
Okay.
Thank you for that. Okay. All those in favor say aye. All those opposed, no. On the amendments, the ayes have it. They pass unanimously.
Move the bill as amended, please.
Second.
Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 1252. Lindsay, Delegate Kelly.
This bill generally consolidates provisions regarding physician assistants with those related to physicians and reorganizes provisions relating to allied health professions that are regulated by the Maryland Board of Physicians. The bill also codifies regulatory requirements, repeals obsolete provisions, and makes provisions consistent across all allied health professions. There are no amendments.
Bill passed unanimously in the subcommittee. Move the bill.
Okay. Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. Passes unanimously. We're going to now move to House Bill 397. Lisa? Delegate Cullison?
1397.
1397.
Yes, 1397. Sorry, apparently I'm getting tired.
Me too.
Join the club.
So House Bill 1397 requires carriers that provide coverage for prescription drugs and devices to limit the amount a covered individual is required to pay in co-payments or co-insurance for a covered prescription insulin drug to no more than $30 for a 30-day supply, regardless of the amount or type of insulin needed to fill the covered individual's prescription. There's amendment on page 106 of your packet, and the amendments are technical.
Delegate Penumelnik or Cullison.
No.
Delegate Cullison.
Right. Thank you, Madam Chair. This reduces that limit on co-payment and co-insurance to $30 a month for people who take insulin, which is one of the most highly used pharmaceuticals by the general public. It will be a very useful thing and save a lot of people money on their drugs for this. I think it's important to note that the Prescription Drug Affordability Board is studying the cost of insulin, and we as a committee can expect a report from them in the next few months that will make some recommendations. I learned that in my consultation with the executive director about what the potential impact of this bill might be on insurance premiums, and he did some research on how it's been working in other states, and it has not had the impact that folks anticipated. With that, I move the amendments, and the bill passed unanimously in subcommittee. I move the amendments.
Is there a second?
Second.
Is there discussion on the amendments? All those in favor, please say aye. All those
Aye.
opposed, no. Please raise your hand. The amendments pass unanimously.
Move the bill as amended.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Is there anyone who doesn't want to be a co-sponsor on this bill? Anyone? Everyone on the committee will be a co-sponsor on this bill. House Bill 1464, Lindsay.
This bill specifies that a part-time physician or part-time physician assistant is eligible for the Maryland Loan Assistance Repayment Program for physicians and physician assistants, and authorizes the Maryland Department of Health to establish prorated loan repayment for the part-time practitioners. The bill establishes the MLARP Advisory Council, which is staffed by MDH. There are
Oops, one of those messages on my computer, which says plug me in right now. Sorry. Delegate Kelly.
Thank you, Madam Chairman. This bill passed unanimously. We love our physicians and we love our part-time workforce. Move the bill.
Second.
Any discussion on the amendment of the bill unamended, correct? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously, and there will not be any co-sponsors on this bill because there are no amendments. And with that, we have completed the work of the day. I want to say to you, this was an unbelievable day that you guys, all four subcommittees, met in between double sessions. You did so much work today. I am so proud of you, so grateful to you. I didn't know how we were going to make it, and you did. We will probably have a short voting session tomorrow on a handful of bills that will come out, as well as a bill that was held today, I think. And with that, please have a wonderful evening.
Can we applaud council and staff for?
Oh my gosh, yeah. Seriously, the staff has worked late and driven home late and every day getting in early, and I don't know what we'd do without them. Thank you for suggesting that, Delegate Hill. I appreciate it. We appreciate you. And we'll say thank you when we have a committee dinner. So with that, do have a good evening, and thank you again for all your hard work.